What do you think about the mask requirement, especially the one for the children?
The masks are the most debated topic when it comes to COVID-19. Actually, there is still uncertainty whether masks works for the general population, and more data are showing that if masks works, there are certain types working, but certain others do not work. And also the evidence coming on masks, whether they work on reducing COVID-19 transmission, they are coming mainly, for instance, mannequin studies. But we are humans. A mannequin doesn't move the head, and when we sneeze or cough, we automatically move our head. So in this regard, I think that for certain indoor areas, masks still could be useful. But of course, another issue that we have with masks is how we use it in every day. For instance, if I take my masks now, this was in my pocket, and not sure how many people use new masks every day or they keep it clean, because this could carry also other issues and infections. Also, the recent trial in Bangladesh, that it's one of the largest trials in the community, it showed that cloth masking doesn't work in reducing COVID-19 transmission. It could be a benefit from surgical masks, but the effect was shown mainly on the age 50 plus. When it comes to masking children, personally, I don't think we should, considering there is still lots of uncertainty, and considering that children do not have high risk of developing COVID-19 complications. Even when we speak about children on long COVID, so having symptoms that can persist over time, actually, the studies that show that those symptoms could be persistent in children come from bad quality studies and do not have controls. A recent UK study, which is one of the largest, actually showed that when we looked at children having COVID-19 and children not having COVID-19, the long COVID was not any different between the two groups. And therefore, I think and I believe that when it comes to children, we should try to give them as a better life as possible, considering that introducing also measures to this age group, like going online schooling or not doing daily activities, could also lead to other issues, psychological issues, to increase obesity. And we have seen, for instance, also in Switzerland, that during the year 2021 there has been a 3.5 kilogram on average increase in the general population of body weight, and that could also lead to higher risk of other diseases and heart disease, diabetes, that could be seen in the future.